You you have to start at right at the basic. I look at it as an inverted pyramid, the whole thing. And if you cut off the bottom of the inverted pyramid, the whole thing just collapses. And the basis for the bottom of the inverted pyramid is that somebody has isolated this virus in large quantities and proven that with an electron microscope picture. And that's never been done.
But Gallo and this fellow from France are the ones that people claim that did discover it.
Yeah, well, the scientists who knew about this said that Gallo stole the virus from Montagnier. However, there's no proof that Montagnier sent Gallo a virus. He sent him DNA and RNA sequences. And then in their minds, they put these bits and pieces together and they said, yes, they all come from a virus. Well, you have to prove it first with an electron microscope picture. And Montagnier said, I couldn't do it. He said, I couldn't find any retrovirus in this material.
Right. So in most other normal situations of a discovery of a virus, they would have to conclude, we don't have anything to go on here.
Right, right. Well, they took shortcuts. The rush was on to find a cure for this new disease that was, at that time, was only affecting...
Well, let's say I always talk about evolution. They said when Darwin came up with his theory, then Aldous Huxley became the spokesman for Darwin, and he was speaking to all these scientists, and somebody asked him the question. He said, "Wow, how come all of a sudden people went on this mad rush to follow Darwin?" And Huxley said, this is what a preacher said, I saw on TV, but he said, because they saw that with with this theory, they could remove God out of the way and they could have all the sex they wanted. In other words, he said it right out in the open. Okay, that's usually what's happening. Okay,
yeah, you're right.
In other words, what is going on here? You think? Why this mad rush to believe this?
If you were a gay activist and you thought about it, the consequences of this not being caused by a virus, but being caused by a lifestyle, and you would say everything that we've gained so far, the gay activist movement, everything that they've gained, all this acceptance, it would collapse.
It would be at risk. It would at least be at risk.
Well, there are a lot of Americans who have nothing against homosexuals and their practices. They have nothing against it. They say that's just a variation of normal. But these people don't like drugs. And the most outstanding thing that they found when they first started investigating why all these gay guys were getting sick was, as Peter Duesberg put it, they were walking pharmacies. These guys were using cocaine, heroin, crystal meth, quaaludes. I think I saw a list. There were something like 40 different drugs that were being used by these guys.
They're seeking pleasure, right? The pleasure of the sexual act, the pleasure of the drugs.
That was part of it. And some of them said that we have been made to feel guilty by Christianity. So we took these drugs to destroy this conscience that we were trying to get rid of.
Mm.
So they took the drugs for different reasons. It's a wonder that they survived as long as they did. But they didn't want the public to know about it. But there were some gay authors who saw through it and were trying to alert their fellow gays in these gay publications, don't use these drugs. They're killing you. And
but so was all the sexual, everything was killing them. How could they just isolate?
They were destroying their immune systems with repeated bouts of venereal infection. And
so the first incident of AIDS that kind of hit the scene, did that come from Los Angeles? Was that?
Dr. Michael Gottlieb noticed 2 or 3 patients that seemed to be severely immunodepressed. So he started questioning them. And at first, most of the people who started researching this came to the conclusion that AIDS among homosexuals was caused by their lifestyle. These guys were going nonstop for 4 or 5 days on drug binges and sexual activities with 10 different people, and they thought, well, that's enough to destroy your immune system.
Plus the antibodies they'd be taking.
And a lot of them took broad spectrum antibiotics to prevent venereal disease, and taking unsupervised broad spectrum antibiotics can cause
that can be enough in itself.
Yeah. Depending on what the antibiotics were and how much you took them.
But mainly they had too much sex, too many drugs, and too many antibiotics working against them, and that lowered.
Not enough sleep and bad nutrition, and a lot of them were alcoholics too.
And what did they call the disease for the AIDS? Didn't they call it gay something?
GRID, gay-related immunodeficiency. I think.
That was the first. That was the first thing that AIDS was called.
Yeah.
Gay-related that's what they thought it was.
Right.
Only something related to the gay lifestyle.
Well, I don't know what order these came in, but it was called gay bowel syndrome too. And Michael Jones said that it could have been the CDC or the World Health Organization was threatened with a lawsuit by the George Bernard Shaw.
George Bernard Shaw?
His foundation.
His foundation, yeah, okay.
Because
he was a sexual animal himself and an atheist, pretty much.
This gay bowel syndrome was shortened in the scientific journals to GBS. Well, the George Bernard Shaw Foundation was called GBS too, and they didn't want there to be any connection.
Oh.
So they stopped calling it GBS, and they used the full title again.
Oh, okay. I didn't know that.
Yeah.
So then, from that, the gay community didn't want it to be called that.
Well, I think most of these guys that were first diagnosed with this new HIV-caused disease, Kaposi sarcoma, which you had purple cancer-like lesions on the skin and the roof of the mouth, and some of the people thought that was caused by these guys using poppers, nitrite inhalants, and those were used to enhance anal sex, and I guess they made it more pleasurable or something, made it less painful. A lot of people were convinced that repeated use of those nitrite inhalants
could cause AIDS itself, could cause
Kaposi sarcoma, and those nitrite inhalants are suspected of causing mutations, cellular mutations, and a lot of these guys were getting non-Hodgkin's lymphoma. They were dying from that. So there were a lot of reasons to think that this had nothing to do with the new microbe.